I'm Michael Miyamoto, cardiologist and co-founder of Puuwai, the Hawaiian word for heart. Puuwai is a solution that helps people optimize their heart health. Heart disease remains the number one killer in the U.S., and rates of optimal cardiometabolic health remain very low. A major healthcare focus is on preventing heart disease before it happens by managing risk factors early. For many reasons, this risk is magnified in low-resource populations facing multiple health disparities.
Who am I? Upset is who I am. They gave me only the lines in this presentation, and then Michael took one of them. Well, meet Sandra, a 55-year-old woman who lives far from any major city, and her physician, Dr. Torres, her doctor at the health center that she relies on.
Good morning, Sandra. How have you been feeling lately?
Hi, Dr. Torres. I've been struggling a bit, feeling tired and not sure how to improve my health.
I understand it can be challenging with your busy work and home schedules. Have you heard about Puuwai?
No, I haven't.
Puuwai is an app that can help us monitor and improve your cardiometabolic health. It's user-friendly and can give you personalized recommendations based on your daily habits.
That sounds helpful.
Yes, it is. Let's input some data ourselves, pull some data from your electronic medical record, and see where you stand.
Goes to, along with Dr. Torres, visits the Puuwai site, and she logs in, she creates an account, and the account pulls in some of the basic information directly from the EHR database, like for example the age, gender, weight and height, and then the last blood pressure readings, as well as some of the lipid profiles. And then while she is still with Dr. Torres, he kind of adjusts this based on the most recent, and then says yes, updates the score. And after this basic information is auto pulled from the EHR, from Sandra's electronic medical record or health record, then Dr. Torres asks Sandra to see how much of her physical activity she's getting on an average. So she says, yeah, it's about 40 minutes per week. Like she basically goes for a walk a weekend, I think. And yep, so she enters that. And then what about the nicotine? Like did she ever smoke? Yeah, looks like she quit about a couple of years ago, but her husband or partner also is an active smoker. So she enters that information, and on an average, on the sleep side, she says, yeah, I barely get 6 hours of sleep. So she enters that, and that's pretty much, like you can see, where Sandra actually is in terms of the profile. And then one other last thing Dr. Torres asks is, hey, how much of describe me about your diet, and she basically goes and fills in or does this survey. Like, okay, she doesn't use olive oils, but she does eat quite a bit of fish and seafood, and some regular whole grains. She makes it at home, and then a bunch of nuts and seeds, pretty much, and then this as well. So she gets roughly the score, and it's shown that she's around at 44 out of 100 kind of score in terms of the cardio health.
All right, Sandra, your cardiometabolic health score is a bit lower than optimal, but we can work on improving that together. I'll recommend you download Puuwai and interact with it regularly. It'll give you tips on how to improve your health, even when coming to the clinic is difficult.
Thank you, Dr. Torres. I appreciate your help.
So Dr. Torres advises her to go use this chat and use it on a regular basis. So it is almost like an extension of Dr. Torres here. So what Sandra can do is that if she has any questions, she can actually ask this chat, And generally, like in a future iteration of this app, there is a feedback, like a summarized note of how the interactions have been with Sarah, sent back to Dr. Torres, so that in addition to the Sandra's EMR data, like the electronic medical record data, Dr. Torres can also look at her interactions with this app. So he can start, for example, in this example, Sarah can ask, okay, what should I do when I feel tired? Right. And yeah, the system kind of smartly figures out that, hey, there's not enough sleep out there, so maybe that's an easy low-hanging fruit to fix. So the system actually recommends, getting some sleep. Why do I feel tired all the time? Yeah, maybe in the mornings in this case. And then it kind of links back. So what should I fix first? Right. And then it says, get some exercise. And I think that's what the first thing is. What Sandra starts using the app, and then she starts learning more about what to do. She starts asking basic questions like, how should I improve my score? Just tell me one thing to do. And the app basically recommends, okay, start with 10 minutes of moderate intensity exercise. I can't bike. Oh, what can I just walk? Something like this. And it does kind of constrain the system. The entire system constrains it to be around the American Heart Association recommended. And over time, Sandra makes this as a part of her lifestyle. Things like, okay, did I skip my walk today? Should I have to catch up on tomorrow? Or can I just do 30 minutes tomorrow? So those kind of details. And over time, Sandra sees that, okay, her fatigue levels are going down. She goes back and then she says, okay, I'm now a lot more active. Maybe I'm just doing 60 minutes, right, per week. So, or maybe even more, even higher, if it is 30 minutes or so, so 80. And then she sees that her score has actually improved. And the next visit, she goes and shows this to Dr. Torres. And what you also see is that her latest non-HDL actually showcased that it is actually in the green zone now. So you will see Sandra sees quite a bit of improvement on her score. Happy with this. She is reinforced on improving her lifestyle, and then she continues to better at that.
Sandra, I'm pleased to see that your cardio-metabolic health indicators have improved. Has Puuwai been helpful?
It's been a lifesaver. The recommendations were easy to follow, and I feel much better now, even though getting to the clinic can be tough sometimes.
I'm glad to hear that. Let's keep monitoring your progress and adjusting as needed. You're doing great.
Puuwai, simple yet powerful technology, bringing good heart health to all.